diabetes is one of those conditions that affects everybody slightly differently. So everybody's unique and needs different management of their condition. So Pretty, thank you for coming to see me. Now you've had type 2 diabetes for how long?
3 years now.
3 years. Gloria, this is your husband Andrew, is that right?
That's right.
Welcome, thank you for coming to see me. And you've had diabetes for just over a year, is that right? David, thank you for coming in. Now, am I right in thinking you've just been diagnosed with type 2 diabetes?
That's correct, yeah.
What's changed over that 3 years for you?
I think the way I manage my diet, definitely.
So basically it's the same thing but a lot less of the junk and more of the fresh, I suppose. That's really what it's about, I think.
Not to snack or not to eat, to take a bigger portion when I could eat it. And I've also taken up exercise again, so tried harder to go for a walk and things like that.
Make more of an effort to go for maybe walks and things like that, not just with my husband, with the family as well. So I think my social life has changed as well.
The goal for everybody with type 2 diabetes is to have normal blood sugars, so that, you know, if you met a stranger or had a blood test done by a stranger, they wouldn't know that you had diabetes.
Yeah.
So it's possible to get to that point without even medication. The other thing just to mention with diabetes is it is a progressive condition. So all of this that you're doing is brilliant and it will slow that progression. But there may come a day where things change and you do need medication, and it's not necessarily because you've failed. It's probably very unlikely that you've or done anything wrong.
Yeah.
It's just that that's the way the diabetes goes.
And what is the first sort of steps of medication? Is it injections or...?
Very good question. No, for type 2 diabetes, the first step is a drug called metformin, which all it does is help your insulin work more efficiently. Do you feel well?
Yes, I do. I think I'm managing well with the medication, with the exercises that I do as well. So I do feel well, yes.
Good. And what medication are you on?
I'm on metformin, and I take that 3 times a day.
Okay. Has that increased or decreased over the last 3 years?
Well, I initially started off with a lower dose, but then I also had another type of tablet. It controls it in a different way, but I've stopped that at the moment. So I think I am managing my diabetes better for that, to reduce that tablet and the dosage.
Once a year, we like to see you to do a full thorough check where we check your feet, your blood pressure. The reason we do all those things is obviously to make sure that your body's not getting damaged by the diabetes. Have you had your eye screening in the last year?
Yes, I do. I regularly get a letter, once a year anyway, from the surgery asking me to make an appointment to have my eyes screened. And then I come here and there's a camera here which takes the photos of my eyes, behind the eyes.
And the photos show the blood vessels at the back of the eyes, so it's a really crucial test, and it's absolutely vital that everybody with diabetes has that done every year. Did you come to one of our education sessions?
I did.
And how was that?
That was really good. It actually gives you information all about diabetes. It gives you information on the diet, reasons why sort of you have to eat certain foods, and tells you how to control it.
And when you were first diagnosed, were you invited to one of the group education
I came
sessions?
here to one of the sessions. There was a big, there was a lot of
I
people.
came as well.
You were
it
here
was
as
about
well,
2.5
yeah.
hours. I found it quite informative, even for somebody not suffering.
Andrew, can I just ask you how Gloria's diabetes has affected you?
Not a great deal, really. We've more or less got the same lifestyle. It's just that we've cut out more junk foods and we're trying to eat more fresh and we're doing some more exercise. But apart from that, you know, it hasn't really played a great deal of difference.
The great thing about advice for people with diabetes is it's the advice for everybody, which
It
is
Well, that's what I
exactly what
learned
you've
from. When I
demonstrated.
went on that course for
Exactly.
2.5 hours, it was quite useful for me because I could see some of the things that I was doing wrong, you know, and I sort of used it as a sort of way of trying to get a healthier balance in foods.